It is 8:30 p.m. and time to get Mrs. Maurice ready for the night. Being a diabetic, she has just had her bedtime snack. She wears dentures, so she requires buccal hygiene and overnight care for her dental prostheses. In this work environment, time is of the essence. Proper planning helps to save time, materials, and effort. This is a leading principle of healthcare practice. Checking users' needs at the start of your shift is part of the planning process. In this case, the PSW makes sure the user has her bedtime snack before she prepares her for the night. An evenly distributed workload leads to better quality care for all users.
Good evening, Mrs. Maurice. My name is Cynthia. Since you already had your bedtime snack, we're going to proceed to your mouth hygiene and also remove your dentures.
The materials used here must be specific to the user to prevent any cross-contamination. If necessary, label the user's personal items to prevent mix-ups. The PSW checks the user's ID and installs her in a seating position for easier buccal hygiene. The towel protects the user's clothing. Wearing gloves protects the caregiver from biological fluids and limits the risk of pathogen transmission.
Okay, so next step, I'm going to remove your dentures.
Dentures are removed as follows. Top dentures first. Grip the front teeth and proceed with a smooth top-down movement. For the bottom dentures, grip the front teeth and pull one side or the other upwards. As she removes the dentures, the PSW checks the mucous membrane of the mouth and the lips for anomalies to be reported to the nursing team. Placing a washcloth or towel in the bottom of the wash basin reduces the risk of damaging a denture if dropped. The PSW cleans the dentures and rinses them thoroughly. She then places them in their container or places them in a towel if they are to be reinstalled. Dentures should be removed at bedtime to prevent any mucus injuries and choking.
Okay, so now I'm just gonna brush your tongue, okay, and rinse your mouth, okay?
The PSW delicately brushes the user's tongue with the toothbrush. This further cleans the mouth and removes any remaining bits and pieces. The PSW then offers a sip of water if the user is unable to do it by herself. She uses a syringe to inject 5 milliliters of water to each side of the mouth and asks her to spit out the water into the emesis basin afterwards. This helps to remove any remaining bits of food in the mouth.
All right, Mrs. Maurice, so we're all done, okay?
The PSW puts away the user's personal items, removes her gloves, and washes her hands.